Hi, this video is going to discuss lymphoma. In this video, we will discuss the lymphatic system anatomy, pathophysiology, etiology, risk factors, expected assessment findings, treatment recommendations, and preventions of lymphoma. The lymphatic system is key to the immune system. Lymphatic tubes branch through the body carrying lymph. Lymph holds lymphocytes which fight infection and destroy cancer cells. Fluid leaks out of blood vessels throughout the body, and in it is waste bacteria and cancerous cells that are drained into lymph vessels. Lymph glands then filter out the waste and harmful substances. Lymph eventually makes it into the thoracic duct where it is emptied back into the blood. Lymph nodes filter out lymph as it passes through, and lymphocytes attack bacteria in them. This system is also made up of the spleen, thymus, tonsils, and adenoids, and they all filter and fight off bacteria. Hodgkin's lymphoma is a much less common form of lymphoma and is distinguished by large cancerous Reed-Sternberg cells. It results from an abnormal change of a lymphocyte to a lymphoma cell, and when left untreated, the cancer cells overrun all the white blood cells, impairing the body's immune system. Non-Hodgkin's lymphoma is a much more common form of lymphoma and usually results from an abnormal change of a B cell, but can also be a change of a T cell or a natural killer cell to a lymphoma cell. Lymphoma cells accumulate, forming tumors and impairing the immune system. This can spread into the spleen, digestive tract, and bone marrow and is referred to as primary extranodal lymphoma.
The etiology for Hodgkin's and non-Hodgkin's lymphoma is unknown. Various types of Hodgkin's lymphoma exist, and the type determines the treatment. Doctors know that most Hodgkin's lymphoma occurs when an infection-fighting cell called the B cell develops a mutation in its DNA. This mutation causes a large number of oversized abnormal B cells to accumulate in the lymphatic system, where they crowd out healthy cells and cause the signs and symptoms of Hodgkin's lymphoma. The most common type of lymphoma is classical Hodgkin's lymphoma, and people diagnosed with this type have large abnormal cells called Reed-Sternberg cells in their lymph nodes. Now we're going to talk about risk factors. Hodgkin's lymphoma occurs more often in men than it does in women. It's most prominent often in early adulthood between ages 15 and 30, especially in the 20s. About 5% of cases have a family link. It's more common in North America and Northern Europe in individuals with a higher socioeconomic background and those who have previous infection with Epstein-Barr virus or mononucleosis. Non-Hodgkin's lymphoma is more prominent in people older than 60, those who have been exposed to certain chemicals, including benzene and some herbicides and insecticides, and those with an infection such as HIV, human T lymphotropic virus, human herpes virus 8, or Epstein-Barr virus. The expected assessment findings for Hodgkin's lymphoma and non-Hodgkin's lymphoma are fairly nonspecific and share many characteristics with other illnesses such as the cold, the flu, and other types of respiratory infections. The signs and symptoms include swollen lymph nodes in the neck, underarms, or groin, intermittent fevers, drenching night sweats, feeling tired all the time, unexplained weight loss, decreased appetite, generalized itching, abdominal pain or swelling, and a feeling of fullness that is commonly caused by enlargement of the spleen, and coughing, shortness of breath, and chest discomfort.
Pharmacologic treatment of lymphoma may include chemotherapy, radiation therapy, and immunotherapy. Chemotherapy is a drug treatment that uses chemicals to kill lymphoma cells. Radiation therapy kills cancerous cells using high-energy beams that are directed at specific points on your body. Immunotherapy is a drug treatment that helps the body's immune system fight cancer. One frequent drug classification used in immunotherapy are monoclonal antibodies. These work by attaching to B cells and making them more visible to the immune system, which will then attack and stimulate the production of new healthy B cells. Non-pharmacologic methods may be used to help cope with the stress of a cancer diagnosis and the side effects of treatment. These methods may include acupuncture, aromatherapy, and relaxation techniques such as yoga, meditation, and massage. Prevention of lymphoma can occur at 3 different levels. The primary level is implemented to prevent the disease from manifesting. This can be accomplished by taking vitamins to boost your immune system, eating a healthy diet, washing your hands, and visiting the doctor frequently for cancer screenings. Secondary prevention is implemented to prevent the cancer from worsening after the diagnosis is confirmed. This can be done by early detection, effective pharmacologic treatment, monitoring for metastasis, and knowing the signs and symptoms of infection. Lastly, tertiary prevention is implemented to soften the impact of lymphoma. This can be done by being cautious of infectious environments, attending follow-up appointments, learning how to do a lymph node self-examination, and attending support groups in order to express feelings and concerns. Thanks for watching our video. You can learn more about lymphoma by visiting our website.